with passionate debate over masks at an all-time high. I want to bring in Dr. Shikha Jain from the University of Illinois to discuss. Dr. Jain, always good to see you. Let's talk about the masks and the evidence, the data that masks are truly effective in fending off infection.
Well, I have to say, I think it's interesting that we're still having this discussion a year and a half into this pandemic. We have so much data and so much evidence that masks work to protect people from this virus, from this very contagious virus. We know that schools can stay open and our kids can stay safe if everybody is simply wearing a mask. And now on top of that, we also have these vaccines that are also adding another layer of protection. So it doesn't make sense to me why, when we all have the same mission, we all want to get our kids in school in person and keep them safe and keep the schools open, why would we not encourage everyone to be wearing masks in schools so that we can keep our schools open? It seems like a no-brainer that we need to have masks in schools if we want to keep the schools open.
What do you think about these mask mandates that are now happening and how the Delta variant changes the equation for public health officials who may want to implement that?
I think there is a point in time right now where we have a very contagious variant that we know spreads very, very easily. And we know kids can get very ill. We know they can end up in the hospital and some can die. We also don't know what the long-term impacts are if a child gets COVID. They may not have very many symptoms now, but who knows what this means 5-10 years down the road if they contract the virus now. So unfortunately, it seems like mask mandates are the only way to really get everybody wearing masks in school so that we can keep our kids safe and keep the schools open.
Doctor, a new study released today shows children under the age of 3 may be more likely to spread COVID-19 than older kids. What's your take on why that might be the case?
So I think this was a really interesting study, especially considering earlier on in the pandemic, we thought that maybe kids weren't spreading COVID as much. It was interesting because, one, we're seeing that the younger kids in this study were more likely to spread COVID. And there's a couple of different theories as to why. It could be because they were having more viral shedding, meaning they had more virus in their nose and mouth that was passed along. It could be because parents and teachers and other people need to have more close contact with kids who are 0 to 3. Kids who are in the higher age groups may not be as in close contact to adults or other family members or other people in their house as often or as constantly. So that's why older children may not transmit it as much. But I think the really important take-home point from this study is that kids can contract COVID and kids can pass it along. And again, just as we've been saying since the beginning of the pandemic, you can get COVID, not have any symptoms, and still pass it along to other people. So again, this study just really further solidifies why it's so important that we put these mask mandates in place and make sure that kids and adults and everybody is wearing a mask in school to keep our kids safe and to keep our staff safe, to keep our teachers safe, and to try to get control of this pandemic and get control of this very contagious virus.
And the immunocompromised safe. Let me ask you really quickly about that because, you know, we've all heard that the immunocompromised can get this booster shot. But I hear that some people are calling their doctor's offices and they're being told to wait. It's not yet approved. When can they get it?
So if you're immunocompromised, and there's a whole list of people who fall into that category. So that would be people, for example, who've had a transplant, or people who are on chemotherapy, people who are on drugs that are compromising their immune systems. All of those people are eligible to get a third shot now. And a lot of people are actually not even calling it a booster for those immunocompromised patients. If you remember, immunocompromised patients, what that means is that your immune system doesn't mount as good of an immune response as somebody who has a fully functional immune system. So in actuality, this third shot might just be the completion that you need to get a similar response to other people who got just 2 shots or 1 shot with the Johnson & Johnson. So if you fall into that immunocompromised category, I would encourage you to go get your booster or your third shot now. You can talk to your doctor's office, you can go to the pharmacy, and you can go ahead and get that third shot now.
All right.
All right, Dr. Shikha Jain, always good to talk to you and get some fresh insight. We appreciate it.
Thanks for having me.
Thank you.